rhinoplasty operation. I had the cast removed today, although the excessive tape is to help reduce the swelling, although not nearly as much as required. One loop down under the tip and back up again is sufficient, but I found I couldn't actually get the tape to stick at all. I have reasonably oily skin, I suppose, and I decided to go a little bit overboard. When the cast was removed, I did have quite a lot of swelling. To be honest, my nose was of a similar size, just with a more bloated appearance to pre the operation, which was a little daunting to first see, but the swelling is very normal at this stage, just on day 8, and I can expect a lot more to be reduced. The scars are completely non-visible already. It's very difficult to see them at this stage, so that can only improve. You would be unaware I've had an operation at this point. The nostrils were brought in, of course, so there is that reduction which I could enjoy, and I was also given a few injections which were, as painless as injections are, to reduce the swelling further. Then after the stitches were removed, which again is totally painless if you use some pinches, I had my nasal cavity cleared of all of the remaining debris, which was fantastic. Slightly uncomfortable for a few moments, but after that I breathed fantastically, arguably much better than I did before the operation, since I've had my deviated septum corrected. So that's a fantastic positive, which I'm very, very happy about. I'm looking forward to progressing how the reductions in swelling go now for the next few videos. I have quite thick skin, so I'm expecting that it might be a slow process, but there is a lot of swelling, which means there's a lot of swelling to go down, so we should see some good improvements. Other than that, I'm completely comfortable. I'm not in pain at all anymore. I wasn't really anyway. The dull ache has pretty much subsided. This taping isn't uncomfortable at all, and tomorrow I will do a video putting the tape on so that my nose can be seen without so much obscurement, and also so I can perhaps try and demonstrate how it's done, although if I'm honest I'm evidently not particularly good at it. And I've got a lot more of the movement back into my upper lip now, which is fantastic. The stiffness here was a little worrying at first. I wasn't even aware that was a normal side effect to be had, but obviously the swelling does come down from the nose, which is why I experienced a little bit of pain above my incisors, and well, pain but aches. And on top of this, I had very little upper lip movement. It's still not back to how it fully was, but it's a small change, a nuance that only I would really look at this stage, and it will resolve. Other than that, I was very happy to see that the nostrils have been put into a more harmonious position, and the scab that was over the lesion I had removed is now gone, and you can see that's healed up very, very nicely. So all of the stitch work was incredibly well done. There is barely any scars visible, and a lot of the scabs have already completely gone, so a few left inside in terms of stitches, of course. They're the dissolved ones that will be there for a little bit longer. Still no sports, which for myself is a little difficult, but I think it's well worth the rest to help the recovery process. I'm keeping up the vitamin C, just for good measure, but apart from that, no longer taking anything else, and continuing to abstain from alcohol as suggested, partially because I have no particular reason to drink at this stage, no parties to attend, not until it's held a little bit more, I think. But abstaining from coffee has proven to be a little bit more trying. I think I will probably start having my morning coffee again soon, just because it's rather difficult to work without it, and I think I'm past the original week, but definitely not my normal amounts, which would have been multiple cups for me. And I'll update again tomorrow to try and demonstrate the progress. Thank you.